Good day everyone, my name is Aldrin B. Mariano from Nueva Ecija University of Science and Technology, BSN 3F, and for today's video, I will be performing on how to provide tracheostomy care. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretion, and skin irritation or breakdown. For the equipment, check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, 2 sterile 4x4 inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, sterile basin, small sterile brush, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, 2 pairs, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. For the implementation, bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Identify the patient, close curtains around the bed, and close the door to the room if possible. Determine the need for tracheostomy care. Explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert. Adjust bed to comfortable working position, usually elbow height of the caregiver. Lower side rails closest to you. If the patient is conscious, place him or her in a semi-Fowler's position. If the patient is unconscious, place him or her in the lateral position facing you. Move the overbed table close to your work area and raise to waist height. Then check for lung sounds. Then place the towel below the trachea site, covering the neck and chest of the client. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site dressing and discard before removal of gloves used to perform suctioning. Prepare the basins and cleaning solutions. Mix sterile water, plain NSS, and H2O2 in one basin, 50-50. Be sure it will fill 0.5 inch of the basin, then add another plain NSS in another basin that will fill at least half inch. Then perform gloving. Now for the cleaning of the tracheostomy. Remove the oxygen source if one is present. Then stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Then press the tabs and release lock. Gently remove inner cannula and place in first basin with plain NSS and H2O2 mixture. Then let it submerge there for a few minutes. Simultaneously gently slide the tracheopad or dressing downward, then discard. Check for some exudates or drainage, skin breakdown, irritation, and inflammation. Clean the inner cannula of the tracheotube using the prepared plain SSS and H2O2 mixture, and use brush to remove solidified or sticky mucus. Rinse using the second basin with plain NSS only, then discard gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze or pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Dip cotton tip applicator or gauze sponge in a cup or basin with stericyline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma site outward. Pat skin gently with a dry 4x4 gauze sponge. Then, slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Then, reapply oxygen source if necessary. After that, remove gloves. Then, assist patient to a comfortable position. Place the bed rail and place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene. Then, documentation. Reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and the lung sounds.